Hi, Abby. What seems to be the problem? Why are you here?
Hey, Doc. I know. I'm getting really bad shoulder pain. I iced my shoulder like after swim practice, only after the day started hurting, and oh, it just hurts so much. It hurts like in the front, and kind of around the side, but not really, and along here. And I don't know what's going on.
Ooh, yeah, that sounds like that sucks. That sounds like it really hurts. Do you stretch after practice or before practice even? No, I really don't stretch after practice. No one else does it, and I really don't want to be that weird person who does. Okay, okay. Like, what's your diet like? I would say my diet's pretty good. I have celiac disease and I'm lactose intolerant, so my diet is kind of like funky right now. I think I eat breakfast most mornings. I am not sure. Okay, I can see how that's really tricky. I know where you're coming from. So do you get any off periods or swim? Do you like have a day off? Do you, I don't know, get a break in between seasons? We practice 6 days a week, so I would say I don't get a whole lot of rest. We have off days on Sundays, but we're supposed to do an ab workout during then, so I wouldn't say we even get an off period. Some after some seasons we get off periods, but they're only like a week long, and even then they're hardly off periods because we're supposed to keep in shape. Oh, okay. Yeah. Oh, that must really be bad. Oh, I can't imagine. So, I'm going to perform a couple of assessment tests just to see what's going on. I think an idea I have about right now is you did something to your rotator cuff. We're going to schedule you for an x-ray. If nothing comes back then, and then, well, if nothing comes back, then we're going to have you come back. We're going to schedule for an MRI, and then we're going to go from there after we get your test back from the MRI. Okay, Abby. The first thing I'm going to do, the first position to see what's going on, or I would call it a test, is the Ludington test. So we're going to start with having our back straight. Make sure to push your shoulder blades together like you're squeezing a pencil. Make sure your shoulders are down so they're not pushed up like this. They're relaxed, but still having your shoulder blades pushing like there's a pencil in between. Then we're going to take our fingers, interlock them like this, and then put them on our head. So when you put your shoulder blades together, you're gonna be in this position. So this might hurt overall, so if it hurts, please just tell me. And we're gonna start like this. So first you're gonna flex your bicep muscles. I'm doing it now. Obviously, I'm not as strong as you are. And my sweater is kind of blocking it. So you're gonna flex your muscles, and then you're gonna relax. So flex without moving your shoulders. Flex and then relax. Flex and then relax. So the reason I'm doing this test is to indicate if you have a long head bicep tear. So it might not be a rotator cuff injury. We're just doing this just to make sure we cover all bases. So this will indicate, like after the test, it will indicate if you have a tear. So with long head bicep muscle tears, especially the proximal, it's right by the shoulder, they show a sign of a Popeye. So a Popeye sign is where your muscle, there's like a lump, like the cartoon Popeye, and how he's super strong, and he has this huge muscle, just like a mountain on his bicep. So you have that without even flexing, basically, or when you flex, you don't really feel the bicep tendon, especially the long head bicep tendon, because that's what we're testing for. When we do it, you show a sign of a tear, and it's like a little mountain like that. So our next couple tests, I'm going to move your arm. I want to feel kind of the natural motion, if there's anything catching, if it's popping, or if it just doesn't feel normal. I can tell by moving your shoulder in like natural positions like this, like holding under your arm, moving your arm like this, putting it back, doing a more stretch. so I can feel it popping. If it hurts, please, I know I keep stressing this, if it hurts at any time, just tell me and we will stop, because I don't want to make it worse and I don't want it to make it feel uncomfortable for you. So with that, I'm going to move your arm naturally. You're going to stretch it, bringing back, pushing your arm. So we're going to have your arm at like 90 degrees. This isn't quite because I'm not sitting correctly. 90 degrees, pushing back your arm, seeing if it hurts. You're going to tell me if it hurts, and we're going to just kind of go through those motions like that. Great job. You did amazing on those tests. I feel like you definitely did something to your shoulder. You had nothing with your elbow or wrist, but you did tell me that you kind of had wrist problems and elbow problems. So that's good that there's nothing else. So it's going to be in your shoulder. I'm thinking it's a rotator cuff like injury. You did something to it, like you tore it, which is not good. Or you did something to your long head bicep muscle. So I'm going to have you go for an x-ray. We're going to see what happens then, see what comes back, and then we're going to go from there. Okay, doc, see you after my x-ray. Back from my MRI and x-ray. The x-ray was so long ago. Oh my gosh. I must tell you though, the MRI was the most relaxing part of this whole experience. I fell asleep. So I'm going to send you to a physical therapist. She's like my twin. She looks exactly like me. It's kind of crazy. Yeah, we work together a lot in cases like this because I want her opinion. She kind of wants mine on other things, and it's just we work well, and I know she'll be a perfect physical therapist for you. So I'm going to send you to her. She's going to give you a rehab plan. We're going to sit down and we're going to discuss your first kind of month before you kind of get into everything, just kind of to get you used to. Let's get the information down. Let's start the healing process in your shoulder, and then we're going to go from there. So kind of going through it again, you're going to get a rehab plan. You're going to go to physical therapy, probably a lot. I don't know how much. She's probably going to tell you. And then also we're going to set you up with a massage therapist. She's also great. We'll both go through it a lot, especially guiding you through this process. So let's get started. Hey Abby, you fell asleep? That's crazy. You must be really busy to fall asleep in an MRI machine. I personally can't because they're so loud and I'm kind of claustrophobic. Hi Abby, I'm going to be your physical therapist today. So I talked to your doctor a lot. We kind of worked on your case together, and I'm really excited to work with you. So let me kind of go through the process of what's going to happen in physical therapy, and then I'm going to show you the rehab plan, and we're really going to get started. I really want you to go back to your kind of full recovery. I want you to get back to swimming as soon as possible, and we're going to do this. Ready?